And the White House is now asking hospitals to email them data about coronavirus patients every day. Earlier, I spoke with Dr. Imran Ali. I asked him why that data is not already being shared.
It's all about epidemiology. It's boots on the ground. So the local information is the most accurate. So I work in 2 health systems, and we get a daily update of who is suspected of having COVID, who is confirmed, and how many people are on the ventilator. And that is updated by people on the ground who are seeing the situation in real time. So it is conceivable that this may be the most accurate way to get the information to the federal authorities, because our EMRs, our electronic medical record systems, don't necessarily talk to each other that well. We don't have a centralized system as we see in other countries, which are mostly state-run.
According to the Washington Post, CDC officials are considering encouraging people to cover their face, not with medical masks, but perhaps with do-it-yourself cloth masks. It's something that the president said that he isn't opposed to for a limited period of time. But do you believe that this would lead people to have a false sense of security, go out in public, and maybe ignore social distancing guidelines?
The thing is, having a mask, a cloth mask, may help people from, coughing and not expelling the droplets out to neighbors, but it still is not ideal because these masks can become soiled, can have virus on it, and then when you take them off, put them back on, they're not properly sanitized, it becomes a hazard in some cases.
We've also seen a lot of myths circulating online about how to treat or avoid getting coronavirus. Can you address some of the misinformation that is out there and what people should know?
Well, I get one from all my patients calling me on the phone. Well, I'll drink hot tea and I'll prevent the virus. But this is really false. The viral particle goes into your bronchioles, into your respiratory tract. It has nothing to do with what you drink, gargle. It has nothing to do with that. Another thing I'm seeing is now these UV lights. They are wands that are used to sanitize surfaces. And yes, they do work. UVC light particularly affects the viral particles by disrupting the RNA of the virus. So yes, but it has to be used in a specific way, held at a specific distance, and not everybody can use it properly.
And like every doctor we speak with, Dr. Ali stressed that the best way to stop the spread is, of course, social distancing.